Labor is a remarkable physiological process, marking the final journey of pregnancy. It is divided into three distinct clinical stages, each characterized by unique changes in the uterus, cervix, and fetus. Understanding these stages is crucial for both expectant mothers and healthcare professionals, as it helps in anticipating what to expect and how to manage each phase. In this video, we'll walk through the stages of labor, breaking down the key events and clinical signs that define each one. Let's begin by exploring the first stage, where the journey truly starts. First stage of labor is known as the cervical dilatation stage. It begins with the onset of true labor pains and concludes when the cervix is fully dilated to 10 centimeters. This stage is crucial, as it prepares the birth canal for the baby's passage. During this period, the cervix undergoes significant changes, gradually opening and thinning out. The process is influenced by regular uterine contractions, which help in the progressive descent of the fetus. Let's break down this stage further into its two main phases, latent and active. Latent phase marks the early part of the first stage of labor. Here, cervical changes are slow and steady. The cervix begins to efface or thin out and dilates up to about 3 to 4 centimeters. Contractions during this phase tend to be mild, infrequent, and shorter in duration. For first-time mothers, this phase can last longer compared to those who have given birth before. It's a time of anticipation, as the body gradually gears up for the more intense phases ahead. Support and reassurance are especially important during this period. Labor advances, the active phase begins. This is when cervical dilatation accelerates, moving rapidly from 4 centimeters to full dilation at 10 centimeters. Contractions become much stronger, more regular, and occur every 2 to 3 minutes. The presenting part of the fetus, usually the head, starts to descend deeper into the pelvis. This phase is further divided into acceleration, maximum slope, and deceleration subphases, reflecting the changing pace of cervical opening. The active phase is often intense, but it signals that birth is drawing closer. During the active phase, several physiological events unfold. The cervix continues to efface and dilate, while uterine activity intensifies. The membranes surrounding the fetus may rupture, either spontaneously or with assistance. As contractions grow stronger, the fetal head engages more deeply in the pelvis, preparing for the next stage. These changes are closely monitored by healthcare providers to ensure both mother and baby are progressing safely. The active phase is a pivotal moment, setting the stage for the baby's eventual arrival. Once the cervix is fully dilated, the first stage of labor ends and the second stage begins. This transition is marked by a shift in the mother's sensations and the clinical focus. The body is now ready for the expulsion of the fetus. The contractions may feel different, more intense, and accompanied by a strong urge to push. This is a critical turning point, as the baby is about to make its way through the birth canal. Second stage of labor begins at full cervical dilatation and ends with the delivery of the baby. This stage is characterized by powerful, expulsive uterine contractions combined with the mother's bearing down efforts. The fetal head descends progressively through the pelvis, navigating the birth canal. The cardinal movements of labor, such as flexion, internal rotation, extension, and external rotation, occur during this time, allowing the baby to adapt to the shape of the pelvis and facilitate birth. Several clinical signs indicate the progression of the second stage. The perineum begins to bulge as the fetal head descends, and eventually, the head becomes visible at the vaginal opening, a moment known as crowning. The mother experiences an intense urge to push, driven by both physiological and psychological factors. These signs help healthcare providers assess when to guide the mother in her pushing efforts and prepare for the safe delivery of the baby. During the second stage, the baby's head is delivered by a movement called extension. Once the head is out, the shoulders rotate to align with the widest part of the pelvis, and then they are delivered one after the other. The rest of the baby's body usually slips out easily. This sequence of events is carefully managed to minimize trauma to both mother and baby. The duration of this stage varies, typically lasting 30 to 60 minutes for first-time mothers and 10 to 30 minutes for those who have delivered before. Length of the second stage of labor depends on several factors, including whether the mother is giving birth for the first time. For prima gravida women, this stage usually lasts between 30 and 60 minutes. For those who have given birth before, it can be as short as 10 to 30 minutes. Monitoring the duration is important, as prolonged second stages may require medical intervention to ensure the safety of both mother and baby. Third stage of labor begins after the baby is born and ends with the delivery of the placenta and membranes. This stage is often brief, but requires careful attention. The placenta separates from the uterine wall and is expelled through the birth canal. Proper management of this stage is essential to prevent complications such as postpartum hemorrhage. Let's look at the mechanisms involved in placental separation. Placental separation can occur via two main mechanisms, the Schultze and Duncan methods. In the Schultze method, separation starts centrally, and the placenta appears fetal side first. In the Duncan method, separation begins at the margins, and the placenta appears maternal side first. Recognizing these mechanisms helps healthcare providers anticipate the appearance and manage the delivery of the placenta effectively. Several signs indicate that the placenta has separated from the uterine wall. These include a sudden gush of blood, the uterus becoming globular and firm, lengthening of the umbilical cord, and the placenta descending into the lower segment or vagina. Recognizing these signs is vital for timely and safe management of the third stage, ensuring the mother's well-being. Proper management of the third stage of labor is crucial to prevent complications such as postpartum hemorrhage. This includes controlled cord traction to assist in placental delivery and the administration of uterotonic agents like oxytocin. These measures help ensure that the uterus contracts effectively, reducing the risk of excessive bleeding and promoting a safe recovery for the mother. Recap: labor is a complex process divided into three clinical stages: cervical dilatation, expulsion of the fetus, and delivery of the placenta. Each stage involves distinct physiological events and requires careful monitoring and management. Understanding these stages empowers expectant mothers and healthcare providers to navigate labor safely and confidently. With the right support and knowledge, the journey from the onset of labor to the birth of a new life can be a positive and empowering experience.